Okay, hi everyone. Welcome to this info session on iScreen. I'm Natalia. I am with Cambridge Digital Health. So we are the mobile app development company that developed iScreen. I'm just going to share my slide deck with you. Bear with me while I set that up. Just want to make sure I have it right. There we go. Okay, panelists, can you see that?
Yes.
Yep.
Yep.
Okay.
All clear.
So just going through introductions on who we've got speaking tonight. So we've got Lindsay, who is a senior lecturer at Anglia Ruskin University in midwifery, obviously. We've got Jessica Case-Stevens, who is with Cardiff University as a lecturer in midwifery. We're going to hear from Sarah Jessidason. She couldn't be with us tonight, so we've got a little video of her a bit later on. And then we've also got Sally here. She's a project manager with Cambridge Digital Health also, and she was the lead project manager on this on the iScreen app. So I'll just run through.
And Natalia.
Oh yes, and myself, yeah. So I'll just run through what we're going to cover tonight. So Lindsay is going to start with sort of why iScreen and why she came up with the app and the challenges that it addresses. I will do a quick app tour. Jess will go into using iScreen in teaching. And then, as I said before, Sarah is going to cover off an example of using iScreen in practice. And then we'll have Q&A at the end. So there is obviously a Q&A that you can use down on your toolbar. If you have any questions as the session goes along, please do submit them. And then we'll go through all those at the end. Okay, so. Right, so we're expecting this session to take about half an hour, just depending on how many questions we have. So I'll just hand over to Lindsay now. Lindsay, do you want to tell us a bit about why you came up with iScreen and a bit about the challenges that it addresses?
Yeah, sure. Hello, everybody. Thanks for joining us. I was responsible for putting the NIPE course into the undergraduate programme because we previously only done it for the postgraduate midwives, and I was really thinking how I could do that in the best possible way. And of all the NIPE elements, so the hips, heart, eyes, and testes, the RA one is the hardest to simulate. So until recently, students relied on actually having to actually use real babies and look into their eyes and hopefully see something. And that obviously, with abnormalities being particularly congenital cataracts being between 2 and 3 in 10,000, they were very unlikely to see an abnormality. So I wanted to develop a tool that I could use that would help to simulate the conditions that they might see and support their knowledge and learning. So I set up an experiment actually to sort of test these skills so that I could have some background information to put forward to get some money to get the app sorted, and set up an experiment with a colleague in the ophthalmology department, and we simulated various red reflexes using cylinders, and Natalia I think is going to show you a picture of that.
Coming up.
So there you can see there were 10 red reflexes there, and those were that were simulated, and they were exactly measured and had a proper lens and everything that was exactly as it would be in a neonate. And then so there were 10, and the midwives looked into all of them 30 times, and we changed the retinas that were at the back. And I think, Natalia, if you show the next one. Yeah, so those were the retinas that we used. So those slotted into the back of those cylinders that we had. And the top 2 rows are normal red reflexes of various different ethnic minorities. And yeah, those are simulations for that. And the bottom 4 are the ones with abnormalities. So obviously the one on the left there, the first one is, no red reflex at all. So that one was, we marked that down as easy, the easiest one. Then the next one along, that was easy too, because that was quite straightforward and easy to see. And then the next 2 were much more difficult. So they were hard 1 and hard 2. So very straightforward, but yeah, that's what they were looking forward to. And we randomly changed them after they visualized the first 10, we asked them to leave the room, and we randomly changed them, so they had no idea what they were looking at. So yeah, and then the results showed, I think Natalia, you can, yes, the results showed for our midwifery students, and if you look at the blue, that's the ones that they got, they detected abnormalities in correctly. So the first one, that completely easy one that was all white, it was only 60%, just over 60% correctly saw that. They actually did better in the second one, which I felt was slightly harder. But the second two, the harder ones, that was quite poor. They only detected sort of 30% in one and sort of 50% in the other. We did the same experiment with third-year optometry students. And obviously they've got loads more experience with using an ophthalmoscope. So it was a good comparison. The midwives were experienced with the babies, but these were experienced with the ophthalmoscopes. And they got the first one, 100% detected that. Didn't do so well again on that second one, but it was similar to the midwives actually. But the two hard ones, they did much better. They detected the abnormalities. So this evidence gave me this research gave me the evidence to put forward a case to get some funding to set up the iScreen app, so that we had something to teach the students, so that our figures would get better, and we could demonstrate how to look for the red reflex properly. So basically, this app provides extensive training opportunities for the students. It enables them to practice. Actually, anyone that uses it, they can practice as often as they like, and get better at it. And it's a good resource to flick up if you're in practice and you see something that you're not sure about. So it's not, for the students, it's not about passing an exam. Yes, it's lovely that they do, but it's about being a better NIPE practitioner. And so therefore, it can be used for your whole midwifery career. So that was the main aim of it. So, I mean, the other side of it is the colleague that very kindly provided the pictures that we use on the app, which are all actual pictures of neonates with these conditions. We worked closely together on the app, and her real reason for supporting me was that her clinic is full of a lot of false positive referrals. So midwives who thought they saw something wrong, and actually it was actually fine. Because I think we always tend to err on the side of caution, but I think the app it allows you to actually realize what should be referred and what shouldn't, unless you're. But I mean, one of the main things was that 75% of the referrals were false positives, but in the BAME neonates, actually it was well over 85%, because obviously BAME neonates have a very pale red reflex, and sometimes that's mistaken for being absent. So the aim of the app is to reduce the anxiety for parents whose babies are referred to this clinic. They have to wait for their appointment. And they take a clinic space that actually is needed by a baby that really does have a problem. So that's where we are. I hope that's okay.
Yeah, thanks, Lindsay. Can you tell us a bit about what's next for the app?
Well, I mean, we'd really, really like to promote the app to be used as a sort of holistic tool for NIPE in general. So with the other elements in it as well, the hips, the heart and the testes. So that's where we're going next, hopefully.
Great, thank you. Okay, so what I'll do now is just move on to a little demo of the app. So if you just bear with me while I share my screen again. Okay, so what you're looking at is the screen that you would get once you log in. So very simple interface. You have here some options to explore eye conditions, and then you have ready to take a test. So explore eye conditions is the same here as the examples list. So this gives you the examples list that you will find in here. So if I just click into this, I'm going to have a look at cataracts because we have, a large number of examples here. So what the app enables you to do is just go through these examples and have a really good look. Down here, you've got some additional information and you've got some references as well. So just taking you through lots of different images.
Each image you can actually tap on and it enlarges as well, so you can make it expand it as much as you want.
So what I'm using here is the web app, so it is available on PC, but like Sally says, if you're using it on a mobile device, you might want to tap on it just to enlarge it so you can really explore what that looks like. And then if we go back to the conditions list, so we have a list here, and these were identified by an eye specialist of some of the, the main ones that sort of present that they see upon referral. But we've also got some examples here of healthy red reflex in different ethnicities. So as Lindsay was saying earlier, there are a lot of false referrals for particular ethnicities. So there's some nice examples there of what a healthy red reflex looks like. So that's really the kind of summary of the image collection. We'll go now back to the home screen. So once you've had a look through all the conditions and familiarized yourself with the images, you can use this feature, which is taking a test. And so what you do is click this, and it will present to you 20 random images. And you are required to select whether you think they are normal or abnormal. So rather than go through all 20, here's one I prepared earlier. So after you've gone through all 20, you'll be presented with this, which tells you which ones you have got wrong. So you can see that the one I did earlier, these are the ones that I got wrong. And what you can do also, if you want to know a little bit more about which condition that you got wrong, or your tutor may wish for you to submit this test, some sort of evidence of learning, you can press this button here, which is generates a report for you. And if I go up to that, here's the report. So you can see here, this has the list of all the images that were presented and also the ones that I got wrong. And then it's a nice little study aid here. It gives you that information, and then you've got here the ones that you got wrong, so you can read up on those. So going back to the app, yes, we'll quit that test. And then we have the resources as well, which just gives some information about the NIPE eye examination. And then we've got some more information about conditions, including conditions that aren't necessarily included in the pictures, but ones that you might see that affect the eye in babies. So that's pretty much it for the app tour. I'll stop sharing now. So what we're going to do now, I'm going to hand over to Jess, who's going to talk about using iScreen in teaching. So just bear with me while I reshare this.
I've got a question there.
Ooh. Yeah, we've got a question asking, is there a way to test yourself on diagnosis, or does it just test you on normal, abnormal? Lindsay, do you want to?
Well, it tells you why you were wrong, so you would then be able to know whether so you can say, I think this is a cataract and therefore it's abnormal, and then when you get your result, you get all that information at the end. So you can't test on what the condition is. Remember, as NIPE practitioners, we are not, as midwives, we are not diagnosing, we're only screening, so we have to be very careful to say that. So you can try and get it correct, but at the end of the day, we are just screening, so that's really important.
Mm-hmm. Sure.
Thank you. Okay, I'll just share this.
There's another question, sorry, Shalette, because it's relevant to what you've just done.
Yeah, absolutely. Yep.
It says, does the test function refresh so there are different images each time, or one time only same images? It refreshes, they're randomized, and so it changes every time, so you can't learn it.
Okay. So Jess, do you want to take it away?
Unmute myself. Hello everyone, so I'm Jess. I'm a lecturer in midwifery in Cardiff University. I'm also the module lead for the NIPE, and I also still work as a clinical midwife as well in a local health board, and as a NIPE practitioner. So my interest in this app really came from a speculative email that probably came at the right time, because I was looking for some new resources that were sort of a little bit more innovative and a bit more flexible and suitable for different learners when it came to putting the module together and preparing the lectures with the updates, but also trying to raise standards in the clinical environment and reduce the missed opportunities for early intervention with babies, eye screening in the newborns and those that had problems. So I think because the module I run is a postgraduate NIPE module, traditionally for local midwives, I was very aware that, particularly in the environment where we work, that if we are concerned about something or not quite sure, we immediately went and asked one of our medical colleagues or another NIPE practitioner. But within the module now, we're attracting students from all over Wales that don't have that easy access. And also because we're currently writing a new curriculum for NIPE to put it in the undergrad midwifery programme. And it is in the NMC Standards of Proficiency, and also about applying digital literacy in curriculums and clinical currency, using the evidence base, accessing different oral, written and digital information from different sources. So really for me, the app fitted all of those. So why did we use it? So as I said, it appeals to different learners, and it's not a didactic form of teaching like a PowerPoint. We can be very PowerPoint driven midwifery education, and also because different learners like to use different things, they may be more inclined to pick up a phone or another digital platform rather than actually go to pick up a textbook if they just wanted to read something quickly or not quite sure what they'd seen, and look for further information. So also that led to some independence in learning for the student, a little bit of self-searching and their own discovery. I also found that the app was very flexible in different environments from the classroom, so using it in a hospital ward environment, a community hub, a clinic, and equally in service users' homes. So we found that it would aid decision making as a supportive tool and also supports the referral process. And I put a question mark here about reducing errors. The example of this is knowing that something's not quite right, but really not knowing what it is, to actually recognizing something that is a normal variation. You might not see it that often, but it is a normal variation. And also as a revision aid for students, and also it's really good evidence of CPD, because there isn't a lot of CPD out there for NIPE practitioners. So the other additional benefits that we found was that actually it was demonstrated quality in an educational resource, and it also avoided the Dr. Google phenomenon in the clinical environment, where actually we've seen clinicians with sort of their mobile phones out quickly under the desk because they're not quite sure about that Googling. Well, actually, this is a really good resource to go to. And also, using it to discuss findings with parents with examples, rather than being able to show them a picture of something, rather than overwhelming them with some medical terminology that they don't understand. It's very, very frightening. So how did we use it? Well, again, so it came from discussing the lack of resources around NIPE, and especially with CPD. And when the email came through, I was really quite interested in this and thought it would be a great addition to the module. So we commissioned it from essentially an in-house budget as a trial. So as a department, we had a small amount of money to use for educational resources that might be outside the normal procurement within the university. So we decided that we would trial this with our students, with a view to using it in the undergraduate curriculum going forward. So during the module session on examination of the eye, they had the theoretical input, and then I introduced the app and I gave the students time to download and look through it, just very, very briefly, and then said, right, go away and try it. Try it in your own time, try it when you're doing examinations on babies, and then come back to me with some feedback. I also encouraged them to show it to their practice supervisors and share it with their colleagues as well, and to try and seek some opinions on it and whether it would be a good thing that they valued it in terms of licensing this really for the future curriculum. And then unfortunately COVID-19 hit, And the students were often redeployed into different roles. Those on community weren't having the face-to-face contacts with the families and the babies. But actually what they did come back and say was that it was really good in terms of keeping connected with the programme and the learning, and it became great in terms of building their confidence, and certainly for revision purposes. And we also found that really it's got potential to spread to medical students and GP trainees, and also advanced nurse practitioners, anybody really who will be a NIPE practitioner going forward. So these were just some of the comments that came from the midwives in the NIPE training module. Also the midwives as NIPE practitioners, some of the specialist neonatal trainees that I showed in the clinical environment, and some of the actual neonatologists themselves. And all of them, without fail, were very positive, and we're really quite keen to look further into this and make use of it. So it's been a very positive addition to us.
Great, thanks so much, Jess. What we're going to do now is, as I mentioned earlier, we had Sarah, a student who'd used the app, who wanted to share with us some of her experiences with it, but she wasn't able to be with us tonight. So we're just going to play a video Sally sat down with her earlier. So if you just bear with me for a moment while I just get that working. Because there's a certain setting you have to put on to make the sound work. So.
While you're waiting, we've got some nice comments in the chat. I think it's great as a quick pick up and refer as a student midwife who's a mother with young children. I think this is a great fit around everyday life. It's good to hear.
Yeah, and it's great to hear, like, from the perspective of us as a mobile app development company, it's great to hear from Lindsay and Jess the story of how this app we've worked on is impacting people, students, educators. It's fantastic to see. Okay, so I've sorted that setting out now, so we should be able to, if I advance the slide, hear this video.
Still got Jess's slide up. Oh no, here it is.
Here we go. Right, I'm just going to play it a bit and you can tell me.
And
can you hear that?
Yeah.
Did you hear that? Okay, yeah. I'll play it then. Here we go.
So can you, so this was all in your third year, and can you tell us how you use the app?
Sorry, I forgot to say that Sarah was a third year student at Anglia Ruskin University last year. She's now at Basingstoke Hospital working as a midwife.
Throughout that year, or at what points in the year, or how you found it helpful?
So during our training, we had a lot of lectures for that NIPE module, and a lot of those involved a lot of information and were quite intensive. So Lindsay encouraged us to use the app alongside for our revision and to consolidate what we'd learned from the university. And yeah, because they had sort of practical examples and it was able to test our knowledge, yeah, it was helpful for revising for our assessment to be qualified to do NIPEs, but also just for placement as well, because we are doing the NIPEs in practice. Yeah, so it was just very helpful because we use it a lot.
That's great. And I hear that you had a really interesting experience during one of your placements. Do you want to tell us a bit about it?
So I was training at Peterborough Hospital at the time, and I was working on the postnatal ward with my mentor. And as part of sort of our daily work, we would be doing assessments on the babies that we were caring for. So this was just sort of a baby check. It wasn't the full NIPE, but I had spotted that this baby had a birthmark around the baby's eye, and it went down on the head and to the side of the body, and I thought it looked very unusual. And the mother had been asking me what it was. And I was quite honest with her, and I was saying, I'm not quite sure. I will get a paediatrician to have a look. And also, I knew that the paediatrician would be looking when they were doing the NIPE. So then I went back and had a look through the notes, and it turned out that the baby had already had their NIPE assessment. And it was a junior doctor who had done it, and they had put it down as a birthmark. So there was no follow-up, no referrals, but I didn't think it looked quite right. So I discussed with my mentor, and then following the NIPE referral pathway, we contacted a more senior paediatrician. So the registrar came and reviewed the baby, and then got their consultant as well. And then that baby went on to have different referrals to find out what it was. So yeah, I didn't think it looked quite right originally. It's not necessarily my role to diagnose what it is, but it is my role to advocate when something doesn't look normal, and when it's out of my sphere. So that's when I referred to the paediatricians and advocated for that baby and the mother to ensure that it was like chased up. So yeah, that the app was helpful in that, because it talks about the different conditions that babies may have to do with the eyes. So I hadn't seen that before, and things like that are very rare. But it didn't look normal to me.
So it gave you confidence to speak up. Excellent. Well, thank you, Sarah, for sharing your experience of the app.
No problem.
And good luck in your job to come.
Thank you.
And
Okay, so thank you, Sally, and thank you, Sarah. It's really nice to see an example of where the app has helped someone to have the confidence to, you know, to really pursue something if they felt it wasn't normal. So thank you. Right, questions. I think we have a few, possibly.
Yeah. So there's a comment to start with. Someone commenting that the feedback ability is a great instant way to encourage learning for those who, oh, it's just all moved. For those who use the app, which I think ties in nicely with what Jess was saying actually about it not being a didactic way of teaching, and it's user friendly, isn't it? And you can go back to it as many times as you want to build your confidence. And then a question from Helen saying, once the student or teacher has the app, is it a one-off fee, and can she or he then keep the app to use forever? So the way we're set up is that we make it a license agreement with an institution or a university. So they pay to use it for as many students as they need it for, and then they're free to dole it out for a year, basically, in any way they want to. So they can provide use for several groups or one group all the way through the year, or so it's renewed on an annual basis according to the number of students.
You've got a couple of questions about, there's one, Annette, how do you access the app? It's on the App Store, Annette, or a Play Store if you've got an Android. So
at the moment, while there's the free trial going, which is until the end of January, so anyone can access it.
Yeah, in fact, I'll just share this now. So yes, on Google Play, Apple App Store. If you're an institution wanting to license it, email us at this email address, info@camdm.com. And you can stay up to date also through social media. So iScreen has an account on Twitter and Facebook, and that's the Twitter handle there.
I think going back to the question about availability, I think we're understanding that there's a demand possibly for individuals to be able to access it. So we're looking into providing that at the moment with a sort of slightly different model to what we've been doing so far with institutions. So watch this space with that. We've got a comment in the question and answers from Bev Lynn. She's just underlining, emphasising, I think, that NIPE practitioners don't diagnose. I know we said that earlier, but it's so the app was definitely designed with that in mind, that it's not about diagnosis, but it's about screening, and it's about building confidence to do that.
And then we have you covered this question around, has the app been shared with medical students and junior doctors?
I haven't covered that.
Okay. Lindsay, what's your thoughts, or Jess, what's your thoughts on that, on just sort of broadening the target audience for this?
I think it would be a really great thing, and certainly for GP trainees as well, because you know, there is a huge difference in the standards of training and education. So actually, it's a really good quality educational resource to implement during training. So I think that they would welcome it, definitely.
I think we offered it to our medical students at Anglia Ruskin when the school opened, but I don't know how many of them have taken it up.
Okay.
There's another question about licensing. The question of how does the current free trial work with the institutions paying for a license fee? So the free trial is temporary, and of course we don't want any of our licensees to come off badly. So we're extending the time of use for the license period to cover the same length of time as the free trial. So you'll get the extra months, basically. Does that answer the question?
Yep. Yeah, I think so. So we have another question here about, will you develop it to include other screening? So Lindsay, you sort of covered that before in future plans, didn't you?
Yeah, it's all ready to go. It just we just need a bit of funding, which we're working on very hard. But it's as you know, it's not easy. But yeah, the material is there. It's just we just need the funding.
Great. And we've got someone here who is a NIPE practitioner who has interested parties, doctors, listening in today. So that's good. We can help get it out to the other people who it would be valuable for. Okay.
Yeah, and we're looking for feedback, which is partly why we've done the free trial. So any thoughts about things that can be improved, and you know, there might be things might need tweaking slightly differently for different groups, I guess, but feedback's good.
Yeah, absolutely. Do students need to give out any personal details? Our legal team are on it with students in IT.
Email address.
Email address, yes. And as Sally mentioned before, we're making this free trial available because feedback is really important. We want to make sure the app is as valuable as possible. So part of the free trial is that you agree for us just to email you on the email address you provide, so that you're able to give us that valuable feedback. But I think there's no other information that we take, Sally?
I think it might ask literally for your name and surname, and that's it.
And your email
and
address.
Even the report that you get, the report download that you get as a result of taking a test, it's completely at your discretion then whether you choose to share it with it's not stored at all except on your local device.
How do you give feedback is another question here. I don't believe there's no at the moment feedback opportunity from within the app, but that is something we could look at. But we have a contact form on our website, and the email address that I popped up on the screen before. So what I might do is you'll receive an email tomorrow with a few links and useful bits of information, so I can just add a few extra points of contact for you to that.
And if you've downloaded as part of the free trial, then you will receive an email with a link to a survey.
Oh, right, I
feedback,
see.
so a short survey feedback. So
Yeah, the question was probably asking that. Yeah.
Yeah. So
Yep.
that is to come, and that will be before the end of the trial period.
I think Bev's made a really good point, actually, that GP trainees have very limited training and would be a great resource for them, and all medical student trainees that she's actually showed it to, and I know she's really supportive of that, have been really interested in it. So yeah, maybe that is something we need to focus on. Thank you.
Great.
Thanks.
Well, certainly if anyone's part of any groups, you know, where they feel that it would be good to share this, you know, we're absolutely happy to hold more sessions or give more information about the app to any particular groups that you think would be useful for. Okay, is there any, we've got, I think maybe any other questions or anything?
If we've missed any, we can answer them in the email we send, can't we? If there's something that we think would be relevant to.
There is a question around time frame in mind for further additions to the app, but again, that's all very dependent on funding, and you know, the more people we get interested in using the app, then the more beneficial that is for securing further funding. So it's a bit chicken and egg, but yeah, we're hoping to get there.
And we'd really like to keep the app free, if we could, and that would, if we get enough users, then that's, you know, we might be able to do that, but at the moment, until we do, we can't.
Great. Okay, I think that covers all the questions. I want to say a really big thank you to everyone who spoke tonight. Thank you so much, Sally, Lindsay, Jess, for joining us, and to Sarah. I know she's not here, but and thank you everyone, all our attendees, for coming as well. As I say, if we can give you any more information, just get in touch. We'd be very happy to help you. Okay, thanks everyone for joining us.
Thank you.
you.
All right, bye-bye.
Bye.
Bye. Bye.